So let's start. So thank you everyone for attending this also very important activity for this month because this month is the National Women's Month, right? So women's health is also number one. So before we start with the presentation, we will all request everyone to stand for the prayer. Thank you. So it's all settling down. So good afternoon. Okay, so thank you everyone again for attending this forum, and also very important to thank our speakers for today. So to welcome, may I call on Attorney Tani. Thanks, Dong. Okay, good afternoon, everyone. So, welcome to this open forum about She Speaks. So, grabe kayo, significant kayo na She Speaks yun for us women. Okay, so an open forum on PCOS, menstrual problems, and menopause. So, we are gathered here today. It is important and it's significant because we are prioritizing women's health, both individually and collectively. So I would like to extend my thanks and appreciation first to the medical division led by Doc Fernandez, Doc Jen, and staff for offering this kind of talk, which is important again to us women, and for joining us in our quest for gender equality by offering this talk, because as what Dr. Jen said, March is the National Women's Month. And this coming March 8th, we will be celebrating the International Women's Day. And I would also like to extend my thanks to our resource speakers for giving us their time, their knowledge, advice, and expertise about our topic today. So, kita mga participants, dili ta mauna ko natin mga pangutanan nilang doc dere. Okay, for sure lang. Okay. So I will not make this very long. So thank you also to all of you, katong bago po na sod, for your presence and participation. And here's to a fruitful and impactful event dedicated to women's health. So thank you and good afternoon. Thank you so much, Attorney Tani. Okay. So again, thank you, Doc, for thank you, Attorney, for emphasizing that this is open forum, so very interactive. So we have also so we have also prepared some small prizes or kuan lang siya para kung kinsa to'y mangutana na adun di reward, no? So dapat mangutana din tanan because this is very important also, no, our health, women's health. So before lang, no, mag-introduce sa atong speakers. So National Women's Month man no, so importante kay takaron naman. Okay, so just like to raise your right hand. Okay, everyone, raise your right hand. And then tap the person to your right and say, you are appreciated. Okay. Next, raise your left hand. Okay, and tap the person to your left and say, you are beautiful. introduce na our speaker. So our first speaker, she had her medical degree at Cebu Institute of Medicine, had her residency training in obstetrics and gynecology in Vincent de Soto Memorial Medical Center, and at present, a consultant at Mactan Doctors Hospital. So let us all please welcome Dr. Lourdes Atoc. Okay, and also our second speaker, had her medical degree at Cebu Institute of Medicine, residency training in obstetric and gynecology, and Cebu Periculture and Maternity House Incorporated, presently a consultant at Mactan Doctors Hospital and also in Cebu Maternity Hospital. Let us all welcome Dr. Jessica Marie Atoc-Bontes.
Good morning, everybody. Chill lang tayo. Question na. Talang may kamay na introduction with regards to the topic, so at least maka-open sa inyo kung say questions. So, na inyong kailangan answers. Thank you for having us here. So, first topic is actually about abnormal uterine bleeding. So the most common concerns of patients that go to our clinic is about irregular menses, heavy menstrual bleeding, missed periods, and sometimes they also complain of dysmenorrhea. So the first topic, our topics actually, there's three topics. The flow of the topics will be from bleeding to PCOS and then to menopause. AUB, abnormal uterine bleeding. To diagnose AUB or bleeding disorders, we usually use the FIGO AUB system 1. So this would show you the normal flow of menstruation. So under the parameters, you can see the frequency, duration, regularity, flow volume. So this will be the parameters wherein we formulate or we ask you questions regarding your menses. So for the frequency, the normal frequency should be 24 days to 38 days. So that's the normal. When you say menstrual cycle, when we ask you about menstrual cycle, so the normal range is usually 24 to 38 days. So the next one is the duration. So the duration meaning the number of days wherein your menses is there. So it usually is less than 8 days. Then regularity, the normal or regular menstruation or the regular menses, shortest to longest cycle usually is less than or equal to 7 to 9 days. So this means that from the shortest duration, shortest cycle to the longest cycle, it should only vary within this number. So the flow volume, this is patient determined. So we usually ask you, is your flow heavier or the usual or lighter? And then the next question that we ask is intermenstrual bleeding, or is there presence of bleeding in between your scheduled menstrual cycle or period? So before we proceed to the causes of abnormal bleeding, let me show you the anatomy of ladies' reproductive tract or the female reproductive tract. So the first portion is the vagina, the outermost portion, then the cervix. This is what we usually check when we do pap smears. And then the uterus, this is the uterus, and the fallopian tubes, and then the ovaries. So most causes of abnormal uterine bleeding are usually in the uterus. So let's let's tackle on the layers of the uterus. So the inner lining is called the endometrium, and then the muscle layer of the uterus is the myometrium. The outermost layer is the perimetrium. So for abnormal uterine bleeding, there are structural causes and non-structural causes. So we will talk about the structural causes since these are the most common ones that occur in women. So the first one is a polyp. So polyp, symptoms-wise, patients usually come to our clinics um, and complain of intermenstrual spotting. But most of them, these are just are asymptomatic, or it's just when they do an ultrasound, a polyp was seen, or the incidental findings. That's the usual for the polyp. It's the most common. So polyps involves the endometrium. So the inner lining of your uterus, or the lining of your uterus. So it is a localized endometrial outgrowth containing glands and stroma in a single vessel. So they look like finger-like outgrowths. So this usually is related to estrogen excess in women. So if there's tamoxifen use, which is the treatment for breast cancer, to people or the women who are obese, they have estrogen excess. Also, patients with PCOS. So those patients also have high estrogen levels, and it can also present with they can also present with polyps. So the management for polyps is usually surgical in the form of polypectomy. So the next structural cause of adenomyosis. So the most common presentation of patients with adenomyosis would be heavy menstrual bleeding, menorrhea. They usually occur in the fifth decade of life. And one risk factor, the most significant one, is multiparity, meaning if you're multiparous, it means you have more than one offspring already. So as you can see in the picture, there are implantations there in the myometrium. So these implantations are actually endometrial glands. So normally the endometrial glands are the one lining the endometrium, right? So when they implant or they incorporate into the myometrium, then that's what we call adenomyosis. And these patients usually present to us with heavy menstrual bleeding. Note also here that dysmenorrhea will also sometimes occur, okay? Since this usually also occurs, adenomyosis also occurs or is associated with endometriosis. So when we say endometriosis, so endometriosis is actually also endometrial tissues that's implanted outside of the uterus. So when you say adenomyosis, it's there on the myometrium or the muscle layer. When you say endometriosis, then it can occur in the ovaries, the fallopian tubes, or outside of the uterus. So they are closely related because they have the same pathophysiology. Okay. So next is the management of endometriosis and adenomyosis is actually individualized. So we can do medical management, especially in patients who are desirous to get pregnant. So surgery, usually we resort to surgery if patient already has completed family size. So they don't need children anymore. So the only management for endometriosis actually is removal of the whole uterus or medical management, so treatment with medications. So same as in endometriosis, we can also do medical or surgical by removing an ovary or the affected area. Or the most common location of endometriosis is actually the ovaries. So they can form so and then on ultrasound they have an ovarian cyst and they would describe it as endometriosis. So next, I just like to point out that actually endometriosis is not part of the AUB classification or the abnormal bleeding because endometriosis usually would present with chronic pelvic pain and severe dysmenorrhea, but not bleeding. It only bleeding only occurs on occasional basis. Okay. So next is leiomyoma. So this one is also very common. It's a very common benign tumor of the uterus. Patients usually are asymptomatic. 30% of them might present with abnormal uterine bleeding. Some also would present with pelvic pain or bleeding, heavy bleeding. This usually occurs in leiomyoma patients. So the tumors are actually consisting of disordered myofibroblasts in abundant extracellular matrix. So it's a hard tumor made up of muscle. The definitive management for leiomyoma is surgical. So if the patient has large myoma but still has no children or is very young, we usually do myomectomy or removal of the myomas itself. Only the myomas and not the whole uterus. But if there's a completed family size, we do usually the hysterectomy, especially if the patients are bleeding or they're presenting with severe pain, and we usually do the hysterectomy. The next one is malignancy and hyperplasia. So this one is another cause of abnormal bleeding. And they usually present with heavy menstrual bleeding and postcoital or intermenstrual bleeding. When we do transvaginal ultrasound or a pelvic ultrasound or transrectal ultrasound, the presentation or the reading would usually say that there's a thickened endometrial lining. So when there's a thickened endometrial lining, we do an endometrial biopsy for diagnosis. When the biopsy comes out and it will say endometrial hyperplasia, we can do a conservative management medically, or if it shows an endometrial cancer, then the preferred management would be surgical already. But case to case again, individualized. If the patient is still very young, we can do medical management instead of removing the whole uterus. Okay? So the risk factors of endometrial cancer, obesity, infrequent ovulation. So this infrequent ovulation occurs in PCOS patients, and then they can also occur in those patients who are obese. And endometrial CA usually is very common in postmenopausal women. So those those who are not yet in menopause usually it's hyperplasia. So the next one is the non-structural causes. I won't tackle on this on all the causes of non-structural AUB since this is very clear. And the only thing that we really actually need to discuss is the ovulatory. So for the ovulatory dysfunction, the signs and symptoms include infrequent or irregular menses, menstrual bleeding, or heavy menstrual bleeding. So they are more common in ovulatory dysfunction is very common in adolescents and perimenopause because adolescents they just started their menstruation. So there's adjustment in their hormones. At the same time, also the patients who are in perimenopause are also on the way to the cessation of the menses. So there's changes also in their hormone levels. So endocrinopathies can also cause ovulatory dysfunction. One of the most common ones is PCOS. So that's the next topic I'm gonna talk about. So polycystic ovary syndrome. Nowadays, actually, this is very common, especially in the young generation. Maybe primarily because of the sedentary lifestyle, no more physical activities. PCOS, what is PCOS? PCOS is the most common endocrine disorder in reproductive age women. When we say endocrine, it means it involves our hormones. The classic features would include signs of elevated androgens. So androgens are actually the male hormones. So testosterone. So when you have PCOS, these are the usual presentations of elevated androgens. Hirsutism meaning excess hair. So because patients usually have mustache or hairy, very hairy in areas where there's supposed to be women supposed to be has no hair. Then acne also is more severe in these women than the irregular menses. So the incidence of PCOS affects 1 in 10 women. So it's very common. And how do we diagnose it? We have something called Rotterdam criteria. So there are actually three criterias, the ovulatory problems, and then the ovulatory problem, this would usually present with irregular periods. It may be missed periods from 2 to 3 months, or it can last longer, like 6 months to 1 year. So before they seek consult. Then excessive androgen, we can diagnose this through the physical exam of the patient. So the one I mentioned earlier, acne, hirsutism, or we can, if they don't present with excessive androgen, we can do biochemical tests like testosterone levels in the blood. So that's one way to check also. And then on transvaginal or transrectal ultrasound, we can see polycystic ovarian morphology. So there are three criteria, and we have to fulfill 2 out of the 3 to diagnose PCOS. Okay, it can be these two, or excessive androgen and PCOS in TVS, or ovulatory problem with PCOS. However, there are also conditions that would mimic PCOS. So we have to exclude them before we diagnose PCOS. So some of the conditions include thyroid diseases, especially hypothyroidism. Then non-classical congenital adrenal hyperplasia, hyperprolactinemia, androgen secreting tumors in the ovary also. So we do further testing through blood tests and also imaging to diagnose these conditions. So the common symptoms of PCOS. Most patients with PCOS, they come to us with irregular cycles or inability to lose weight, excessive body hair or facial hair, loss of hair on the head or alopecia. That's also one common symptom. And then acne. And this actually is one of the reasons why patients who have no menstruation and then are trying to get pregnant have difficulty getting pregnant. And then when we do ultrasound, they show up with polycystic ovaries. So the complications of PCOS are mainly reproductive and metabolic. So for this one, obesity. So if there's an increased body weight, usually there's more, or the symptoms are more severe. It's directly proportional to the weight of the patient. Diabetes is also 2 to 3 times increased risk in PCOS patients. Uh, this one is endometrial cancer because of the excessive estrogen levels in PCOS patients due to the anovulation can develop endometrial cancer. Heart disease is also one complication since in patients with PCOS have higher lipid levels, the bad cholesterol or the bad lipids. So this one actually describes mental health. So if you're a patient with hirsutism, you have acne, you're obese, then it would really affect your mental health. And because patients may become depressed, it's very common also. So the first line of management in PCOS, this is the most important that you need to remember since lifestyle management or healthy diet and exercise, regular exercise should be the priority of all women with PCOS. And for the treatment, it's actually individualized. So we treat the symptoms of the patient. So the number one that the patient can do is this, healthy lifestyle. With regards to the treatments, we usually give birth control or anti-diabetic drugs if it's needed or if there's severe symptoms. Okay, so in summary, since PCOS actually is a lifetime disease, it's forever with you, but you can manage it. So it's very manageable as long as you go seek help from your OB/GYN. We can give medications to lessen the symptoms, at the same time help you lose the weight and maintain the healthy lifestyle. Okay. The next topic would be discussed by Dr. Atoc. Good afternoon again, everyone. So my topic is about menopause. Okay. So what is menopause? Natural biological occurrence experienced by all women. Um, there is a permanent cessation of menstruation when a woman has not had her menses for 12 consecutive months due to loss of ovarian follicular activity. Loss of ovarian follicular activity. So when there is loss of ovarian follicular activity, the main hormone that is the main culprit is estrogen. So there is low levels of estrogen. So the age range of menopause is from 45 to 56 years old. And in Filipino women, the average is 47 to 48 years old. Sa Philippines. Important. Menopause at 54, 55, 56. I hope. So what happens during menopause? Actually, during the birth of a woman, uh, you have 1 to 2 million eggs follicles in your ovaries, and it gradually declines once you reach puberty, about 500,000 eggs. But when you start your menstruation, these eggs would also be depleted. Like every time you have your menstrual cycle, no? Until you reach menopause. So there's changes in the estrogen levels, especially during menopause, because wala na may follicles, no? So there is decrease in reproductive hormones, mainly estrogen. So estrogen is the primary hormone of the reproductive organ of women, and also it has the protection on the skin, the heart, the brain, and bones. So these are the effects if ever your estrogen level would fluctuate. There would be, so what to expect when your estrogen fluctuates? In the early stage, there is heavy or irregular bleeding, forgetfulness, dali na makalimot, no? Yun ako. Flashes, depression, anxiety, irritability, muscle or joint pains, fatigue, lack of concentration, migraine, low self-esteem. Ano mo? The early stage. It lasts from 2 to 10 years. It's like kaayo. The FPGA stage, ilan, nag-stop na yun, nag-stop na yun ang production sa estrogen. So there is vaginal dryness, itching and irritation, inability to control urination, and UTI is more common in this stage. There is painful intercourse, thinning of the skin, including the vaginal mucosa, and there is low sex drive. The late stage, you can have osteoporosis, heart disease, Alzheimer's disease. That's why it is recommended that treatment or management of menopause should start here in this early stage. The first 5 to 10 years of having these signs and symptoms, you should seek consultation already. So why is it important to manage menopause earlier? Earlier meaning in the first 5 to 10 years of the appearance of signs and symptoms. Early management of menopause is important because aside from relieving menopausal symptoms, it will also protect the patient from long-term health risks later in life. As was mentioned earlier, those osteoporosis, cardiovascular disease, and Alzheimer's disease. So for the treatment of menopause, for the mild and moderate symptoms, we can have the non-drug therapy such as lifestyle changes, also lifestyle changes in your diet and exercise. No? And there is non-hormonal therapy. So this is an alternative to hormone replacement therapy. Okay.
And it's because of the associated risks of the traditional hormone replacement therapy that many menopausal women would resort to these alternatives. So you can have first in those first 5 to 10 years, you can start on this diet rich in phytoestrogens, regular exercise, wholesome habits, healthy lifestyle. And, and it's mentioned here that we have complementary therapies for those symptoms, the acupuncture, biofeedback, stress reduction. Just associate with your friends, be happy. And there are also alternative medicines such as herbal supplements, more on estrogenic diet. So the main treatment at first is our hormonal replacement therapy to restore the diminished hormone levels in women in order to relieve symptoms of an imbalance. So the drug therapy would really relieve the vasomotor symptoms, urogenital atrophy, prevents osteoporosis or treats osteoporosis, may prevent cardiovascular disease, cognitive disorders, dementia, and skin atrophy, and it will improve sexual libido and quality of life. So, and these are the forms of treatment already. We can use the psychical combined pills. So it's individualized really. And those hormone replacement therapy, there are forms of implants, patches, creams, sprays, and gels. But this HRT should be avoided if you have a history of breast, ovarian, endometrial cancer, unexplained vaginal bleeding, and history of blood clots, or with those varicosities, so with tendency to have clots or thromboembolism. So alternatives to your lifestyle changes also or alternative medicine. Thank you. My talk is really short, so the process is long. Really, thank you.
Thank you so much, Dog. Their mother and daughter Tanya. Okay. So questions. So, the floor is yours. Sherman. Nanay, question.
Labis siya naman ako. I would like to inquire, Doc, if this is really, shall we say, more about supported with evidence, medical evidences. If you have to eat constantly chicken meat, does it one of the causes for having polyp? That will increase the testosterone level. Actually,
But I've heard about hormones being injected in chickens. No, but open ko kabaw kung saan kayo pang-inject sa chicken. No? Pero actually, estrogen itself can increase, basta elevated ang estrogen. We would we would say that it's an exogenous or an outside source of estrogen. No? If there really is inject or they really are injecting chickens with hormones. Pero I don't know if it's proven or not. Pero if it's an exogenous source, then estrogen plays a role in um, development of polyps. Pero di ko kayo na Yes, yun anak. Wa magugoy, poultry. Wako ka ba ako nag-inject pa dito? Hormones at chickens. Pero estrogen itself. Any exogenous source of estrogen. Pwede na siya makapos. So, if you say exogenous source, it can also be in the form of pills. Okay? Pwede man siya, di ba? Or na irregularity or hormonal problem ang patient, then there can also be elevated estrogen levels. So that can also cause formation of polyps.
Another question.
This is no longer connected with the questions that I've raised. This is in relation to the removal of the uterus for the women. Is there any side effects pertaining to the removal of the uterus in terms of hormonal imbalances? Like your senses, you are constantly feel, like for example, karamiin ka ng.
With regards to that, actually, if you say you're only removing the uterus, then no. If you remove the uterus together with the ovaries, then there would be effects because the ovaries are the ones that's forming the hormones. So when you remove ovaries lang, it can also cause side effects like because that's what we call actually surgical menopause. So we're removing the ovaries. We remove both ovaries, then there's no ovaries to form the hormones. Then you will develop the menopausal symptoms. It's like that. But it's like that. But if you say only let's say there's a myoma on the patient, we don't, if the patient is still young and not in the premenopausal or postmenopausal or in the menopausal stage, we leave the ovaries. We only remove the uterus and the fallopian tubes so as not to induce menopause early. So we wait for her to undergo the normal or natural menopause. Claro, Rato.
For you, ma'am. Ay, ma'am. So, early age ng menopause sa inyong patient and panito. Like
There are all actually early menopause na cases, let's say. We call it early menopause, but actually there's usually a problem related to it. So there's this term called premature ovarian insufficiency, or the one we call POI, wherein the women who are less than 40 years old, they would present with menopausal symptoms and their cessation of menses already. So that one, it's a different thing from menopause. It's a failure of the ovaries, where there's insufficiency. Same actually. Same to menopause.
Hello, yun daw. Happy question, doctor. I've been diagnosed with hyperthyroidism. So since 2010. And for, I think usa na siya sa reason nga nung maglisod og buo bata. No? So nakabuo ko in 2020, adili ako yung kumana. So nanawi baby 2021 siya na tao, and then karon naglisod na sa me. And pero after ko, I'm 37. But during my pregnancy, on my 5th month, na normal ko sa hyperthyroidism. I think akong indog, i-try to niya o kanang normal yun before ko maka-deliver. And I'm normal man sa ako, vaginal delivery man sa nakuha. So akong question, Doc, is, normal man ko ron, but I'm still having difficulty magka-baby balik. So, na may tendency nga mobalik jud akong
Actually, ang
hyperthyroidism.
hypothyroidism, once managed or within ka sa normal, hyperthyroid, mama, kung within ka sa normal limits sa imong thyroid na test or function, thyroid hormones na mo, wala ra gyud siya yung problem actually. But age matters. Wala na yung chance. Habang, based on readings, mura 35 above is medyo lesser na ginagawa ang chance. Kaya high risk naman sa yun. Plus the endocrine problem. Pero nakapamagyaboy ba? Never okay. So, ang siguro
Another question, Doc. Kanang term nga prolapse, kanang that's like, I'm not sure if the same prolapse, vaginal prolapse, oo, vaginal prolapse, kanang, kung sa in layman's term pa nang wani us ang imuhang mattress man na Doc, kanang ingon nila.
it's a different topic. It's actually called pelvic organ
Yeah, okay,
prolapse.
different topic. Okay, pero ako na nag-answer. Sorry. Actually, nakuha na. After I gave birth, mo sa na effect sa ako. So, katong ako ang OB, gingnan mo ko nga, also to yung solusyon, itangtangon tanan ako ang uterus. Once nga ma-achieve na daw ko nun ako akong number of children na gusto. So, kanang kung nga na ba daw ba, like for example, kanang taod-taod na wala pagyapon ko mabot ako 40, wala na siya i-effect sa ako ang lawas, kanang prolapse, ang ako.
Ang POP or ang pelvic organ prolapse actually is weakening lang na siya sa inyong pelvic muscle. No? So, kasagaran, ang risk factors usually, ang patient is nag-anak, isa. Kung older ta, di ba, ubos na, especially kung menopause ta, ubos ang estrogen, ang elasticity nato, matter man sa, ang muscle nato, di na kayo siya strong. So, weaken ang muscle, actually, mo ka siya pag-cause na muna na siya lower
Wala pa. Wala pang
pelvic
ako.
organs.
Intention na na, so.
Isa sa factor is kung ano bitang mga uma prone sa sila. So isa sa na kanang mga constipated kayo na patient every
Tagaan ba yata o
first four ba?
approval o sunod June?
So mo na siya actually ang cause
Maluwag po.
pelvic organ.
Deadline man yung June.
Extend, alam mo good
June.
rating
Na what if wala pa siya
siya
na-approve?
ka-severe.
Hangtod karon.
Usually kung gawas na gyud siya,
Television na
yun na siya get pregnant kay di naman
Ako
okay.
i-follow up siya din. Tapos ako. Ang
There
i-follow up
would
niya
be
sa
a
naman
chance of, let's say, imuhang
nahatag naman
before
sa ako.
imuhang fallopian tube or na-stretch yung fallopian tube. So, ang egg, dili na sa siya ka-travel as freely, as normal. Pero kung let's say, mild na siya, nara sa ibabaw, ang buwang patients, ang usually, iba-elevate lang ang lugod, or iba-reduce lang, sulod ng balik. Pero surgical ramang yun ako. Pero kani siyang surgical if mo decide ni mag-surgery na or i-remove na lang ang uterus if ang patient in pain or naanapit kayo murag infection, sige nag-infection tungod kay bukos na siya. Pero kasagaran yun ani nila, makita na yun na ang cervix ang bukos. Pero kung mild ra na sa ibabaw, actually dili ra mga
I think we're kana siguro ako okay, marag wala ko man ni on. Wait up lang ako ni. Thank you so much, Marto. Ako ang question na mo.
Good afternoon, doctor. I just want to ask, I've been diagnosed with PCOS po, and then nag-wonder lang ko when would be like the best time to get pregnant before before it's too late, right? Mom lang daw nagsasabi mo age, kaya wala pa yun.
Yeah, mas
Yun doc. Na-undergo ko ang 2013, gioperahan ko og gikuha ko ang uterus kay nam ko'y mayuma niya, kung mayuma naman sa lining sa uterus. So, hysterectomy, isa naman kay wala ma-over. Ako pa na kaningon akong OB kay ni na once na makuha na nga akong uterus, connected ako no sa tutoy. Sakto ba? Kung na ay magbantay daw ko sa tutoy kay kuan ko sa kanang kon uterus. So ako pa na need budget ko mag-mammogram yearly or kay para to check sa tutoy?
sa inyong family history, ma'am, breasts.
No, none.
But when we reach the age of 45 or 1,
So need.
annual namang gidun na dapat.
So how
So,
often?
but in terms of the hysterectomy and the wala may
Wala. So,
they remove the ovaries, ma'am.
no, na. Kuan
Wala.
uterus.
Uterus lang yun.
Hysterectomy ra.
But we usually advise if we reach menopause, mammogram every year.
Every year.
Question.
Good afternoon, doc.
So, now, my question regarding ang sa kanang menstrual cycle lang kay kuan. Kay last February 4 to 8 daw kay mao akong period, and then akong mama kay wa mo siya lingaw for the week, gihagad ko niya og exercise ng mga 1 hour exercise daw pa niya, zumba and like cardio sa lain. Then after a week na daw, after atong katong menstruation, then exercise for a week, period ko 1 day. So, yeah, after ato, abi na ko kanang in a month kay 2 periods akong mag-get. Pero 1 day rato siya, then or to siya, doc, do I need to kanang consult na sa kanang OB or something, or normal rato siya, doc, kay nakuyawan ko.
Na exercise na heavy exercise can cause bleeding. But if it's just a single episode or ano, observe.
Nasa ko second doctor daw kanang sa kuan daw sa kanang sa period daw kay kanang akong lola ug akong mama mo gud ang naa sa house niya. Di jud ko pwede magpahilot ano to. Pwede ra. So, kaya pa, we have a lot of questions.
Good afternoon, Doc. Another question, Doc, regarding sa kanang dysmenorrhea. Kay ever since marag elementary or high school kay grabe jud kay ako dysmenorrhea, like pag naka-try ko kanang muli jud ko sa eskwelahan kanang gusto ka ko nya kanang grabe effect na kanang ana mo ko sila ako mag-inom og kanang medicine kay kanang
dili daw dapat kay marag maanad ang imong maanad ako no. So ako kay marag ay karon kay marag ni anak ko igagaw kay marag katanag and yeah. Niana siya nga kanang niana ko ng doctor ka kanang once ko na magsakit ang puso marag ingnan na lang jud niya. Kato ako kay unsa na di siya ko mainom kay kana laging ako ra jud siyang kanang ang puso na jud ako siya niya. Ako grabe naman jud kay like morning like sa office kay di na jud ko ka work kay sakit jud kay akong puso nandun lang jud maabot ko sa balay ikagabi niya. Ako kay sige mo inom og tamban niyo kasi maglagot ko sa galing kay murag grabe na kay akong pag-antos ba niya. At the end of the day kay mo inom ra gyapon og tambal so murag say ko andok nga kana murag
Actually, with regards to pain relievers, okay ra gyud kay ang ato ang pain relievers hindi man pareho before. Nakatubitaw na ay addiction or opiates ba. Karon ang safe ra gyud ni atong pain relievers.
pero is it normal dok nga kanang murag kaduha ko mainom.
Naay uban gyud kay number one, imo sa usasad ka factor is the tolerance of the pain. Ang lain-lain tao, lain-lain babae, lain-lain man ang tolerance. So, nagiuban nga ubos og tolerance ang pain. So, mas severe nila actually ang same ra na grade. Pero if ever ikon ana, pwede ra gyud na maximum let's say methylamic acid, pwede man kamunti ka na 3-4 times in a day. Safe ra man na siya, dili ra sad ni sila na type this type of pain relievers dili naman makapos kay wala ma-dependent kanay nana.
And nakoy like question daw kay kanang ako work sa office kay work ako man jud ang work dili jud sakit ang puso niya. Pagkatawa ko sa mga uban nga workmates kay man siya nga og Miss Ayn panganak na Miss Ayn kay work puro na siyang sample para mag kaya ako kapag hindi sakit ako pero sakit ang puso na number choice ka dyan na ito magkabili na sa mutaron ng mga isa kaya kanang atong panahon ba so mga choice dyan siya kaya ako kay Marag wala man dyan sa plano na ako ever nga magka-baby kaya ako nga sige na lang mamay magsakit na akong puso mamay kay Marag tas lang ako na ko man dyan ang obligasyon sa anak so is it true dog nga kanang is it true dog nga kung if ever kung mga anak kay mawagtang na dyan ang sakit sa bahay
Actually uban.
na about 10 or 8 or 10 years ago, my last fallopian tube was taken out due to ectopic pregnancy. So, so usa na lang nabilin, dali ra unta ako mabundis, so usa na balay way nyo. Wala pa so
Ngano ka di Juna?
Di ba duha ka ovaries, no? Usually mo take turns pangod sila. Or dili siya ingon na pirmi kanina nga side. So ang imuhang fallopian tube mora siya agian padung sa uterus. So ang imuhang kung right ra na fallopian tube ang atong sa right side na.
over nanay position ni kasi na so after na wonder man yun ko na naasad yun daw ko na PCOS and myoma.
Most likely.
So mo to'y nakaingon. Ato ning ipakuha. Kung sa man how like kano sa man ko palo kay pakuha sa dakong mayoma. Naman sad mayoma.
Nasa kay mayuma.
Yes. Ipakyo. Kanang so since 2016 kay gamay pa mo kuno kayo. Ngayon ang doctor ayaw sa i-remove kay ma-trauma daw ang traumatized kay pag-ora man ko gi ko ana tong sa left fallopian tube. So since then kay wala dayon ko ni ato doctor kay feeling nako okay naman ko. Na siya na ako tungahin ko 5 months. Oh, hindi na ako pregnant ko, but then negative. Unfortunately, so what yun? Negative. Ito nga siya, 3 months po nga non-stop. So, abi na kong tapal po to sa 5 months na what. Sure ko tungahin. Karon, naitabo, dali po kay 8 na lang daw akong hemoglobin na bilis. So, dali-dali ko nila o pa-check-in sa hospital kay and then you call that raspa, i-clean everything yun kay tickets jud daw ang lining, very actually. Yeah, yeah. I was also told the same way that Tani na kanang once nga if I think the family is complete kanang maka-decide na ko like pila ka ako with, they will proceed with the the kanang ko ana dyan, removal of the uterus. Yeah, so nabangi ko ninyo kampo og donor. Basing ba di ay? Although niikon sad sila, kanang very slim sa daw kuno ang chances kay the other fallopian tube that's left is that does not look well also. But since kay the technology is wa man nagka backwards, so basin pa daw. Yan tanaw ni mo dok, ano ni?
I-check imong fallopian tube in terms of, let's say, katong hysterosalpingogram, saline infusion,
O marag kay
katong
naman
ipadaganan ng water.
ay kana mo yung wala pa karon mag-check ko. Tingnan siya, magpa-inject ko na ng mga glutathione, nga with placenta and everything.
Glutathione
So,
can
they
help.
help.
Glutathione can help in infertility.
Oh, makuha na ito mga
Unsa pa atong buhaton, unsa pa imong mga injections. If really manage the mga polycystic ovaries, wa man kay ovulate. Wala pa ka di ovulate. So, wa yun kay itlog.
Pero ni-reach ko og ano, kabon at some point, ganyan na ang doctor nga very, like, wapa na daw kuno kaayo ang di okay na siya. May magita ko aton time adok ang donor na po. Kasi nagwagwan ni, so wala na hinukon. So, iwan na dok. Ang katong placenta dok, okay ra na siya. Kanang itong i-appeal nila sa gluta with placenta, lycopene, and ginkgo biloba.
Glutathione, folic acid, L-carnitine.
Kanang siya. Appeal na. So, kanang secret ba kung ni Dok, pero wala ito ko it took a year na medication ko atong like kanang natla ihatag number of pill na 28 days na good for 1 year. Clara yata ang name o para ma-regularize mo tungmong yun siya sa sakto nga date akong period. So for about since 2016 up until so karon lang nabalik pag November nga wala pud ko nagpungahan. So feeling na ko tungod na sa akong katambok. No. So di na ta ayaw na
Wait,
pag
may wa pa kay donor, wa pa kay sperm donor. Regulated na ang hormone. So, mag-pills na lang muna ka.
balik na pud ko ang to kamahal. Pero sa kung saan na yung pills.
Mahalan ng pwede sa
Pero kailangan po ko prescription na doc no din ano ni Dra okay so kanong tayo magpalit na ka but doc thank you kayo doc ha for accommodating my question. Thank you.
Share lang ko gamay sa story ko sa ako last 2021. 2020, grabe jud kayo akong bleeding. As in, magpupugit siya ba, sinag-diaper na ako. And then, nagpa-check up ko, ang gingon sa OB is tanggal uterus. Drop jud ko atong nga time. 37.
age matters, you know, is yung kumulatin sa age.
Nya kato dok ni balik gyapon ko sa akong OB, and then yan na siya nga kanang kumagkuan lang daw mig giraspan ko niya, giscripan ko niya. And then gibiopsy, kamot nga kanang pregnant daw ko. Nya kuan ba kanang tawag gani? Kuan daw ko ana niya ko niya. Grabe daw ko no lalom daw ko no sa akong something wrong naglibog ko niya ba. What is day ko
Sa
niya?
ultrasound, wala nakita na pregnant.
Wala sa dog. Yang gikuan dito kay yang akong gipa TBS niya. Gi-check dito akong uterus nga daghan ko ng murag something baga daw ang lining. Niya na mura ko nag yang gidring-dring naman to niya dito mo ni mong uterus niya. Mo ni diri na yung mga burot-burot daw something murag sis ko no something ana. Ko dayon daw. Saan man na siya daw siya. Basta ka magtanggal uterus tayo and then dili na ka mag-menstruation. Hulo, may complete na ako. Mura ginana ang bako feeling. Dili sa do ka ng bata pa ko. Pwede ka na ang dili sa basta na ang maraming options.
Actually, basin ka to bleeding ni mo tungod dito sa miscarriage.
Kuan
So,
siya
dili
do
na
kay
kay siya mo recur. Sa buta na after the miscarriage, mo balik pa na regular movements.
Sige, since 2015 man ko dok, pag human ako panganak sa akong bunso, so ni undergo ko ato ka ng nag-pills ko, injectable nga pills sa karahay na sa tusyano niya. Kuan na siya, 6 months ko nagpa-inject ato. After adto dok, pag-stop na ako dok kay katong 6 months nga napa-injectable ko pills, kuan siya ang effect beto sa ko ato kay murag ginagmay na lang jud ang akong dugo inana sa dili ko product na niya akong gi-confirm sa nga normal ra ba nga
Normal.
Normal
Normal
na
na
ira daw na siya.
every 3 months nga injection.
Still every month, every 1 month o kada bulan.
So, expected na siya actually nga basta na kay hormonal na intake or kanang injections, makakause yun ng abnormal bleeding. Pwede na siya on and off spotting, anytime ra, pwede na siya mag heavy bleeding, pwede na siya mag no menses. Lain-lain siya effects, lain-lain na babae.
Mo dito after pag-undang bitaw na ako ato dok no wala na ko nagpa-inject kay murag maglabad naman ako ulo niya sa kuto na kay ko sa tanan niya murag dali kay ko kana ang dali night times sa kanin maglakot jud ko niya mohilak na ko walay dahilan gani ko no sa reaction ang ano mo niya na dili magabdan sa kung balon no sa naman ko normal pa ka anahan pa ka sa kumanan kaya ko wala to ni una po after 6 months dok niya muna to dok mga pila na to ka months nga wala ko gidugo gulo grabe jud mga piti atong murag na 5 siguro to ka piti ako ni check ana puro man jud siya mga negative inana niya naabtan to siya a year dito na jud dok nga murag 2 months na ko ga bleeding grabe ang akong dugo ato nya mo dito nahutan ako og dugo i-admit siya ko ato og makando kay para maabonuhan og 10 bucks kanaabot nag 320 ang ako ang hemoglobin 28 328 to
Usually, after mag-injectable, nakiusahay na dili siya mo issue na ang moments. Okay, siya, pero dili sa care. Most probably na anay problem sa hormones. Or kanto na pregnant ka, nalahos ba? So, nadayunan ka nga na may pwede man na kung gikan ka mag-contraceptive, wa pa ning regular movements, masudlan ka, ma-pregnant, kunya, dili mahibawan nga buntis, na bukid lang kalit, miscarriage ni ay. Pwede na siya maitako. Pero kadto, dili man, wa pang good gibaw, ultrasound, kanang matter man. Dato'y findings are
yung dog giras pa ko niya giscript mo to nga gibiopsy niya mo lagi to buntis kuno ko niya murag na miscarriage ba inaana niya nya karon kayo ang question ako dok ba kay last January 10 days ko gidugo last December wala ko gidugo last November 15 days pud ko giriglan no sa man akong dugo yung kablinti na basa akong dugo yung bago pa yung tawong naabonuhan.
pero wala na kaya ni method of contraception, pills.
Wala na jud do, wala. As
Kinis
in,
ka to nga.
o katulad jud siya do.
Ako advice ni mo, pa-ultrasound ka. ultrasound para ma-check kung hormonal ba siya or basit yun PCOS.
Pero,
Or may problem in terms of, let's say, kanang mga adenomyosis, kanang mga cause mo na heavy bleeding. So, ultrasound mo yung maka-diagnose kung unsay problem. Actually,
thank you kayo, Doc.
So, nang dalang ko klaro do nga kanang inverted bitaw nga ovary tinuod na nga maglisod og panganak. Bali ang ovary ang uterus o
Dati hindi ko siya may magtanong kung sana ako.
normal yan.
Ah.
Pero, ang more common na variant is katong antiverted or nagana nga mattress. Pero retroverted, wala may problem.
makaanak gihapon. Pero gamay ra no. Ako sad. Gamay ra lagi. Gusto ko daghan.
There's one question sa Zoom. Michelle, how? Michelle. Good afternoon po, Doc. Is it normal po? 3 days lang ang tagal ng mens. Wala na yung spotting. It has been for 2 months na. Last January and February this year.
First time niya nga. The usual niya, we usually ask kung sa iyahang usual menstruation. So kung let's say less good ni for her compared sa iyang normal before, pila age mo? Matter sa age.
Age matters.
Since pag-menarche niya or since pag-start sa iyang menstruation, na yun niya every month. Pwede naman gihapon. Normal variant siya, pero kasagaran if dili na niya the usual, most probably nasa na siya underlying na hormonal.
Okay, Doc. Thank you, Doc.
Ay, hapon daw. Ay, daw ka nang, ang sako ang case mo good.
Kaya na mo pasyente, oy.
Okay, every menstruation ako, mag-conjugate ka ng severe nga dysmenorrhea. Sometimes kay like, mo pass out jud ko. So, kasi mga causes ana do kay wala ka masag ko so far na kuan nga na-diagnose nga na ko'y PCOS.
Kaya ultrasound na ba ka?
Wala pa
Wala
sa
pa sa So number one, ang pinaka-common gyud na cause of severe dysmenorrhea is endometriosis or katong ang implants na sa ovaries bitaw or anywhere outside the uterus. So kanto siya pilit manggud na siya nga klase. So kung i-explain nato ang reason nga nung mahitabo na siya, kung menstruation ta natay for example mag-retrograde menses, mura bitaw mubali ang ato ang backflow ato ang blood and then musud sa fallopian tube and then to the ovaries or sa katong surrounding area. So mo na siya kung ang blood is pilit ba yan. So kung during menstruation nato, mublit sa na siya kapil ang katong murag mga implant. So kung mublit to siya kapil, ang tendency pain ang ato ang mapil tungod sa adhesions or sa pilid mo. So, kasagaran, present gani og severe dysmenorrhea o niya, beforehand, dili sila tig-dysmenorrhea, we usually advise them to have ultrasound again. Kay basin endometriosis.
Pero ako ano yun daw, kay hindi mo kayo siya heavy ang droplets lang niya, sakit mo siya.
Dili siya actually mo matter ang amount of flow ni mo in terms of ang imong pain. So, pwede man gud kato atong gitawag retrograde, no? Nga menstruation, nga mura bitaw mo backflow sa ibabaw instead of gawas siya sa upos. Pero dili gud mo matter ang amount na gawas nimo. Basta ang imuhang complaint is pain, ato gid na siya i-check. Pwede sa siya. Dili bitaw directly proportional nga kung heavy kayo imong mens, mas severe ang pain, dili na siya. Thank you, Doc.
the question on saya, Doc, are there any food or activities that can trigger dysmenorrhea?
Ang kuan na bang yun, no? Ang ilang advice lang is kailangan na kay regular exercise. Kay uterus is also a muscle. Kaya ang ilahang advice is as much as possible, ang imuhang diet is healthy. So, kanang mga more on fruits, vegetables, less salt, less fat. Pero in general, actually, any mga problems in terms of hormones, mo matter gyud ang diet and exercise.
Thank you, Doc. Another question, Doc, if advisable ra ba daw magpa-pap smear if virgin?
Ang number one, kaya para for everybody's knowledge, ang pap smear actually, we only check for cervical cancer. Muna itong primary reason why we do pap smears. So, cervical cancer is caused by the virus called HPV, which is a sexually transmitted virus. So, pap smear, we usually advise to those, let's say, 25 years old above who are sexually active, especially if they have multiple partners.
That's all, Doc. Thank you so much.
Kasama din ko lidong ato kay siya nakakon sa kong magwangan ng bugoy. Ano buntis ko. Yung ako si Doc, ang problema na sa nibalik na sa to, akong regular nga katong pa-check up na ko ng mga sa isang kabuan, ikatulong ko doon, may anak gani, o sa hindi ko doon duha ka buwan. So advice ka po siya Doc, kung kuan ka ng ultrasound TVS din katong kuan, o hindi mo siya pwede para pa ko para makuha to akong pulip gani abi na kung makuha na siya pag ako magpanganak di ba limpyuhan mo na siya di na siya makuha dahil may uban dili.
Actually, ang polyp, di ba, sa lining na siya sa mattress.
Mm-mm.
Every month na mag-menstruate ka, ang lining man na mo slough off. So, nanay times na inig-menstruate mo, samot na kung heavy siya, magawa siya pill. Pero ang only way na mo determine magod in terms of presence of polyp is with sa
TVS ka po siya Doc. Sige bato lang niya ako.
Thank you.
Last question.
Last, ay follow-up from ito ni Doc ay ano nag-research naman ko ni Doc, naganahan lang ko kanagikan dyan sa imong kabay sa Doc. Regarding lang sa kanaging murag, Doc, for example, nga kanang padungko-dugon, and then mga sila nga kanang inom og kanang dili ko inom beer, so murag soft drinks, and then kanang sa ako nabasa kay dili siya tinuod, kay placebo effect ra siya. Pero anong naman siya Doc, kay nagka next day. Placebo effect kay ba? Pero kung siya ka next day siya ba?
Hindi, kailangan mag-sign off.
Ang menstruation. Okay. So, dili siya tinadok.
Menstrual naman na siya kasi ito.
Hindi, naman sila dok nga ka nang, if mo inom ka ng beer or coke kay kuan, mo kusog ang flow sa imong kuan. Sa dugo.
Timing
Is there a significance of the menarche, yung first menstruation in the female, and menopause or later years?
So, usually, regional maka-point out ang preliminary can also occur.
Early menarche. What age? Early, di ba? Menarche is more than 30.
Well,
So, later na may ka, 16 years old ka. So, may problema yun or wala?
Kailangan na
Depende.
i-work
Work up na yun. Okay. Yes.
Sila, kasi kung gusto nila, sila dapat menopause kay kung sa imong age the time nga nag-start yung period plus 50 years that's the age nga mag-menopause ka how to rate that?
Dili siya pero Doc, I think it's related to Doc. Kung early ka mag-menor, pasakutan na early ka nag-menstruation, no? Naman tayo fixed amount of follicles. So every time you go, you have menstruation, nagsigisag ka o deduct sa imong follicles. So muna siya, murag this is in relation to katong mo early sa di mong menopause, kay ning deplete naman siya. So nagana mo deplete, kung early ka nag-start, mas dali sa siya makurot imong follicles, di ba? Mura siya inana nga relationship. Dili siya plus minus. Kaning PCOS as I said earlier, lifetime na gyud siya. So once ma-diagnose ka with PCOS na gyud ka forever. Pero ma-manage anak. As long as lose siya, number one, lose gyud the weight. Okay na kay bisan unsa una to pag-correct sa iyang hormonal problem. Kung dako siya, nagyak ng problem. Sa katag-tatag tendency balik na yun.
Pag-informative siya doon attack doon para
Man siya, endocrine problem.
pero kailangan na mag-magaling
Their source of credit. That's something mas daghan ka i-produce ano. So, mas contribute sa siya another problem.
O, napay question. Sorry, Doc. Mangusana na ko, unsa yung long-term effect sa kanang injectable nga contraception?
Unsa ato na injectable? Norifam or hindi.
Murag both na iba kuan man na 1 month yan ay 3 months. Norifam o kanang
Lahi siya ang components. Ang Norifam or kanang monthly nga injections actually contains both estrogen and progesterone. Ang Depot contains only progesterone. So progesterone only na siya nga injections ang isa. So the combined na type katong combination of estrogen and progesterone. Ang number one gid ana na risk factor any dili injectable itself. Any contraceptive na let's say ang pills combined man sa na siya. Ang number one gid na problem ana is kato bitaw cardiovascular effects, blood clots kana siya. So mas higher gid ang risk ana. So muna di kayo mi pa kung contraceptive ang imuhang pangita, and then you have hypertension, you have DVT or kanang mga deep vein thrombosis or kanang mga precocities or myocardial heart condition or blood clots or blood problems, dili may tighatag o combine. Among preference yun ko, kung sa mo akong long term, let's say mo abot og more than 5 years. So, kanto na lang kang, kung let's say 10 years, IUD ka, kay walay side effects, if ever. Kung kanang waiting na lang for menopause, IUD is the best contraception kay wa man siya hormone. Kanang copper iodine nga available sa atuang health centers. Wa man na siya hormone. So, imuha lang is, kailangan lang din mo siya i-frequent checking every year lang ka. Imo ipa-check ang iodine. Pero in terms of side effects sa hormones, wala siya.
Okay, no, thank you.
Bye-bye.
I think now questions were answered and kapangutana na jud sila no sa ilahang dugay na nga ay di ba matana. So yes, haraman mo magtandok. I think naingnan mo ni gani Doc nga for fertility katong andok na apil vitamin C. So we'll be giving out vitamin C for everyone. From Dr. Fernandez. Okay, so moment lang no to award the certificate for our dear guest speaker, Attorney and Doc Niza. Certificate of appreciation is presented for her invaluable contribution as a speaker for the National Women's Month activity. She speaks an open forum on PCOS, menstrual problems, and menopause, given this 5th day of March 2024 at Mactan Cebu International Airport Authority, Lapu-Lapu City, Cebu, Philippines. This certificate is presented to Dr. Lourdes Atoc.
Your picture, off yung siguro ng
Thank you very much. And the second certificate of appreciation for her invaluable contribution as a speaker for the National Women's Month activity. She speaks an open forum on PCOS, menstrual problems, and menopause, given this 5th day of March 2024 at Mactan Cebu International Airport Authority, Lapu-Lapu City, Cebu, Philippines, presented to Dr. Jessica Marie Atoc-Bontes. Thank you very much, Doc. Dr. Thank you. And everyone, thank you.